If you're having trouble getting full knee extension, then this is the video for you. We're going to share with you the best exercise to straighten your knee with the least amount of pain and effort. We're also going to explain why it's the best exercise. Hey, it's Glenn here from Mehab, the world's leading physical therapy alternative, where we educate and empower you to take control of your recovery. If you're new here, make sure you click that subscribe button, and all the links mentioned in the video can be found in the description below. As always, this information is meant for education and demonstration purposes only. With that out of the way, let's get into it. There are a couple of really important things you should know before we get into the best exercise. This information will significantly impact your recovery. If you've not watched our video about the myths and misconceptions of stretching, or our video on why you should stop getting your knee cranked on by a therapist, make sure you watch those. I'll link them in the description below. The first thing to know is you had full extension on the operating table. Your surgeon takes your knee to full range of motion in both directions to make sure the prosthesis is working properly. This is really important to know because it shows that it is not tight tissue that's limiting our motion. If it was the tight tissue, we'd still have limited motion on the operating table even though you have a new knee. You lose range of motion because on the table inflammation hasn't had a chance to kick in significantly. Once the inflammatory process gets going, the knee will swell, resulting in increased pain, tissue sensitivity, and loss of range of motion. That is the only reason you do not have full range of motion. It is vital to control, reduce, and prevent additional swelling. Decreasing the swelling will help significantly with the range of motion and your pain levels. There is a limit to how much you'll be able to reduce your swelling as you've just undergone some major trauma, but the more you can minimize swelling, the better. This is why we also do not recommend therapists cranking on total knees. If you haven't watched that video, it's an absolute must and I'll link it below. Okay, so on to the best exercise and why. This exercise is incredibly simple and far more tolerable than what most people normally suggest. To do this exercise, simply sit near the edge of a chair or sofa so you can place your heel on the ground. Make sure that your chair is stable and you're not so close to the edge that it tips forward. Place your hand or hands as close to your knee as you can, being careful to avoid the incision, especially in the early days. Gently press down and backwards towards the foot of the chair, essentially at a right angle to the leg. Do not push towards your toes. Press and hold for just a second or two, typically with a cadence of pressure on and pressure off. Take a brief break until symptoms return to baseline and repeat. An alternative option is to place your heel on a stool. Try them both and see which one allows you to generate the most force with the least amount of effort. There is also no problem in having your partner assist. Just make sure they're pressing towards the base of the chair and let them know if the pressure is too much or too little, and take breaks as needed. These should be repeated as many times as you can. The key is to perform these frequently and consistently throughout the day. Generally, people should aim for 2 to 5 sets of 10 every hour or two, and progressively increase as symptoms permit. So why is this the best exercise? Because it provides short and moderate stimulus to highly irritable tissue, which makes it much less likely to increase inflammation. Prolonged or high force loads are much more likely to overload the healing tissue, resulting in damage and therefore increasing inflammation, swelling, and pain. Because it's much more tolerable for you. Often people will hold stretches for 30 to 60 seconds or do a low load prolonged stretch such as the heel prop or prone hang shown here. As most can attest to, this quickly becomes torturous. Even normal tissue will become painful if placed on stretch for too long. Performing a brief hold, pressure on, pressure off, will stimulate the changes that we need without the high pain levels. It is much easier to tolerate knowing that the increase in pain is only for a second and then you get a break, because you are in control. No one knows what you're feeling except you. How can someone dictate what you can tolerate? Being forced to endure your knee being stretched is ridiculous. It creates massive anxiety and fear for absolutely no benefit, because the real progress is made by you at home. Despite what people believe, it is your ability to stay consistent with your home exercises that ultimately determine your recovery. Having your knees stretched, as I hope you learned in our other videos, does not increase your range of motion. It does not lengthen tissue. Range of motion gains are due to improved tolerance to the discomfort of tissue extension. Tolerance to a stimulus comes from repeated exposure to that stimuli. Those 1 to 2 stretching sessions do a big fat zero. It's like deciding you want to do the splits. Being stretched for 20 minutes twice a week will not do anything to achieve that, but stretching repeatedly every day by yourself and staying consistent will eventually get you there. Your tissue is healing and it has a poor tolerance to stress. The main focus of the first few weeks should be controlling and decreasing swelling. Any range of motion exercises should be very light, intermittent, and under your control. Do not panic about stiffening up or getting behind in range of motion. You have time. Make sure you subscribe, as our next video will go over the best exercise for getting your knee to bend. If you have any questions or comments, please leave them below. Make sure you subscribe to our channel. Thanks for watching, and we'll catch you on the next one.